Animal models of neuropathic pain. Group 3A, Yeva, Rose, Eleanor and Katie. In this presentation, we will be reviewing animal models used in the research of neuropathic pain. We will cover the disease itself, its current treatments, the animal models in use, and their potential alternatives. Neuropathic pain is a chronic pain condition which arises from nerve damage, also known as neuropathy. It affects 7 to 10% of the general population, and pain can arise spontaneously from a gentle touch. Symptoms can include abnormal sensations named dysesthesia, hyperalgesia, which is a heightened sensitivity to pain, and allodynia, which is a painful response to a normally non-painful stimulus. Other common symptoms include a burning or tingling pain and sensory deficits such as difficulty in detecting heat or cold. A wide range of conditions can cause nerve damage and neuropathic pain. Chronic hyperglycemia in diabetics can lead to nerve damage, and this is the most common cause of peripheral neuropathy in the UK. Certain viral infections, like the herpes zoster virus, which affects the spinal cord and nerves, can also lead to neuronal damage. Neuropathic pain can also be caused by physical injury, trauma, or compression of nerves. Individuals with cancer may also experience neuropathic pain from tumours compressing nerves or damage from chemotherapy. Autoimmune conditions like multiple sclerosis, when the nervous system is attacked by the body, can also cause neuropathic pain. Neuropathic pain is unique to other kinds of pain, in that common painkillers such as paracetamol and ibuprofen do not relieve it. Therefore, other treatments are needed. Drugs acting at calcium channels include the anticonvulsants gabapentin and pregabalin. They bind to the alpha-2 delta subunit of calcium channels, reducing sensitization and nociception. The anticonvulsant carbamazepine is also used. However, as with all drugs, there are adverse effects, including sedation, edema, and weight gain. More severe effects caused by pregabalin include suicidal thoughts and actions. This is particularly dangerous because patients suffering with neuropathic pain tend to have higher rates of depression. For this reason, antidepressants like tricyclic antidepressants and serotonin norepinephrine reuptake inhibitors can also be used in the treatment of neuropathic pain. Although not used directly to treat the pain, they can help with the general well-being of patients. That being said, it is well known that the adverse effects of tricyclic antidepressants include suicidal thoughts and behaviour and can make the symptoms of depression worse. Topical therapies include capsaicin, lidocaine and botulinum toxin. These therapies are usually recommended in patients with local neuropathic pain. Capsaicin exerts its pain-relieving properties by desensitizing the pain receptors via activation of the TRPV1 receptor. Other topical treatments include muscle relaxants such as baclofen. There are fewer drug interactions and adverse effects with topical treatments, but their use is limited and more research is needed. Opioids are sometimes used to treat neuropathic pain. There is a lot of controversy surrounding the use of opioids, as they are highly addictive and can easily lead to dependency and abuse. Additionally, opioids are not always suitable to treat neuropathic pain, so using them puts the patient at risk of addiction with no guarantee of pain relief. Animal models are required to test a new drug in development before it reaches clinical stages. Animal models are also used in the research of diseases to identify its mechanisms and potential drug targets. Through a wide range of techniques, animals can be given diseases which may be the same or mimic those seen in humans. Animal models are useful as they allow the effects of a drug to be seen in a whole system and allow the safety profile of a drug to be found. 3 key areas should be looked at when assessing an animal model. Its etiological validity. Does the model have the same or very similar origin of disease? Its face validity. Does the model display the phenotype of the disease? And finally, its predictive validity. Can the effects of a drug in humans be predicted using the animal model? In the research of neuropathic pain, an ideal model should produce similar symptoms like allodynia, hyperalgesia, and spontaneous pain. Animal models of neuropathic pain fall under three main categories: nerve injury models, drug-induced neuropathy models, and disease-induced neuropathy models. The most common animals used to study neuropathic pain are mice and rats. There are a wide range of animal models used in neuropathy research. However, in this presentation, we discuss 4 specific models covering all 3 categories. 2 quantitative methods used to measure pain in rodents are the von Frey test and the radiant heat test. In the von Frey test, monofilaments with different bending forces are applied to the plantar surface of the foot. The threshold force for paw withdrawal is measured to quantify pain. In the graph shown, the withdrawal threshold in rats was greatly reduced after nerve injury was induced. In the radiant heat test, a heat source is focused onto the plantar surface of the foot, and the reaction time for paw withdrawal is measured. The difference in reaction time between the 2 back paws is measured. After nerve injury, the withdrawal time in rats was significantly reduced. Pain can also be assessed in animals through behavioural signals, such as paw elevation and licking, limb guarding, and facial signals. The images below show the physical signs of pain and injury in mice, such as closed eyes, hair standing up, and ears facing forwards. In rats and mice, these facial responses are measured by the grimace scale. Although more accurate measures of pain than quantitative methods, the issue with behavioural assessment is its subjective nature and the difficulty in quantifying the pain response. Nerve injury models involve cutting or tying ligatures around nerves to produce injury and inflammation, similar to that seen in neuropathic pain. Spinal nerve ligation involves ligating and cutting one or more of the spinal nerves going to the foot. Tight ligation of the sciatic nerve is carried out in partial sciatic ligation. In chronic constriction injury, 4 loose ligatures are placed on the sciatic nerve, and an immune response to the sutures leads to nerve swelling and constriction. Finally, spared nerve injury involves the common peroneal and tibial nerves being cut, while the sural nerve is spared. Since its introduction in 1992, the spinal nerve ligation model has been widely used for research into neuropathic pain mechanisms and in screening for new analgesic drugs. The model involves tightly ligating the L5 or the L5 and L6 segmental spinal nerves in the rat. The operation results in long-lasting behavioural signs of mechanical allodynia, heat hyperalgesia, cold allodynia, and ongoing pain. In this study, researchers investigated the analgesic effects of naringenin on the development of neuropathic pain using a spinal nerve ligature model in rats. The data demonstrated that repeated administration of naringenin was able to attenuate mechanical allodynia and thermal hyperalgesia induced by SNL. Axotomy is the most extensive form of nerve injury model. In this model, the animal is anaesthetised and approximately 5 mm of the common sciatic nerve is removed. The adjacent saphenous nerve is also injured, inducing complete limb denervation. This causes the animal to develop painful anaesthesia. Autotomy, or self-mutilation, of the foot is also observed. The extent of autotomy is used as a measure of pain. However, some have argued that the mutilation is merely a result of the complete anaesthesia of the limb. The common issue with all animal models of pain is the difficulty of knowing what pain is actually perceived by the animal. Another important consideration is that most patients do not develop neuropathic pain following nerve injury. The frequent development of allodynia and hyperalgesia in animal models does not mirror the normal human response. There are important ethical considerations when inducing nerve injury and pain in animals, as suffering is unavoidable. Additionally, most animal models of neuropathic pain last for a period of weeks, whereas the clinical course of neuropathic pain presenting can be many years. Vincristine is a widely used chemotherapy agent that is used to treat breast cancer, leukemia, and other malignancies. Clinical use of vincristine showed that it has neurotoxic effects on peripheral nerve fibers, producing sensory motor neuropathy. Although it is unable to cross the blood-brain barrier, it causes microtubule disorganization and endoneurial swelling in the periphery, which initially affects temperature and pinprick sensations, followed by axon and motor function loss. This produces hyperresponsive activity in C-fiber nociceptive neurons and sensitizes dorsal horn neurons. It is given with saline in rat models to prevent vessel deterioration. Vincristine produces good models of neuropathy, as the animal models have allodynia and it produces predictable neurotoxicity and shows similar effects from animal to animal. Although the animals have neuropathy, this doesn't affect the animal's general well-being, and they still have good motor function. High doses of vincristine cause significant rates of mortality, but this can be reduced by giving smaller doses at regular intervals. However, this causes significant suffering for the animal, so the method is ethically questionable. In this study, rats were dosed with vincristine at 30 microliters per kilogram per day. They were also given intraperitoneal injections of saline, morphine, pregabalin, lidocaine, mexiletine, and tetrodotoxin. Injections of morphine effectively reversed allodynia in the rats, and lidocaine significantly reduced the allodynia. Pregabalin had a slower onset but showed longer duration of anti-allodynia effects. Mexiletine had a marked effect with a longer duration. However, tetrodotoxin, even while used at the highest possible dose, had no effect on allodynia. Diabetic neuropathy is a painful complication of diabetes, involving progressive neuronal damage and dysfunction. Streptozotocin is commonly used to induce diabetic neuropathy in animals. It is a naturally occurring antibiotic that is extremely toxic to pancreatic beta cells. This leads to the development of type 1 diabetes. If administered intravenously, the animal develops mechanical and thermal hyperalgesia and tactile allodynia in 3 days. The model has good etiological and face validities, as the cause and phenotype of the disease match the disease seen in humans. One issue with diabetes-induced neuropathy is that it leads to metabolic diseases such as ketoacidosis, which cause changes in growth and motor activity and could affect the observed pain behaviour in animals. Other side effects include lethargy, bladder distension, polyuria, and diarrhea. Allodynia is also more severe in the animal model than is observed in humans. Shown is an example of diabetes-induced neuropathy being used as a model to test a novel analgesic drug. Streptozotocin was used to induce diabetes in rats, and the von Frey test used to measure pain response. It was shown that single administration of the drug improved mechanical allodynia. Chronic administration relieved mechanical allodynia for up to 1 week after treatment discontinuation. Duloxetine, a standard analgesic agent for the treatment of diabetic neuropathy, was also used on the model to confirm its predictive validity. Many people object to the use of in vivo models in any kind of research, but the use of animals in neuropathic pain research is particularly questionable because of the pain it inevitably inflicts on animals. This is particularly true in diabetes-induced neuropathy, which causes animals significant suffering. The complexity of these systems also limits the analysis of drugs, as there are many potential effects on pharmacokinetics and pharmacodynamics. The 3 R's are an important principle used in animal research to reduce the amount of suffering animals may experience. The first R is replacement. This means trying to use alternatives to animal research where possible, such as in vitro models. Reduction involves using the fewest animals possible to get the results you need from an experiment. It also uses the lowest animal possible to get the results you need. Refinement involves using procedures that cause the least suffering possible. In vitro systems may be the solution to the ethical issues surrounding in vivo models. They involve growing primary cultures of cells from mammalian embryos, then adding drugs and measuring response. This means there is no need to use animals in the earlier stages of drug development, while still investigating molecular events. However, cells in these systems quickly lose their potential to divide and so apoptose. These cultures can also be contaminated with non-neuronal cells that rapidly divide. Although this eliminates the need for animal models in early development, in vitro systems cannot provide all the information needed to pass a drug to clinical trials, so animal models are still needed at present. An in vitro model used in neuropathic pain research involves reprogramming fibroblasts to exhibit characteristics of many different neuronal subtypes. Transcription factors are used to reprogram the fibroblasts, and a variety of models can be recreated. For example, chemotherapy-induced neuropathy. The reprogrammed fibroblasts are able to sense noxious stimuli, and this is particularly useful because human fibroblasts can be used. However, use of reprogrammed cells is not fully representative of how neuropathic pain manifests itself in living organisms. While the need for animal research is reduced, it is not eliminated. Animal models are an extremely important tool in developing our understanding of neuropathic pain and testing out potential treatments. Despite their importance, it has proven difficult to accurately determine what pain an animal is experiencing, as there is no direct way to measure pain. The ethics of inducing pain and disease in animals must be strongly considered as well, as animal suffering is essentially unavoidable in neuropathic pain models. In vitro systems could help reduce the need for animal research. However, there is currently no viable way to entirely replace animal models.